Anxiety by Krista Nelson. What is the etiology of anxiety? Anxiety disorders don't just have one cause. There are a handful of reasons for anxiety. There is a combination of factors that play into anxiety, which include biological causes, family history, psychological issues, and stressful or traumatic life events. Biological issues: it affects the regulation of the neurotransmitters, serotonin, norepinephrine, and gamma-aminobutyric acid. Serotonin affects mood, appetite, social behavior, digestion, sleep, memory, sexual desire, and function. The norepinephrine is connected to the flight responses that regulate sleep, mood, and blood pressure. GABA-aminobutyric acid aids in relaxation, sleep, and overexcitement. The organs that are affected are the skin, brain, heart, stomach, the intestines, the pancreas, reproductive system, immune system, and your joint and muscles. Skin, brain, stomach, and heart. Anxiety causes the skin to have acne, blisters, psoriasis, and random breakouts, and also eczema. Anxiety has been linked to heart disease. The brain is affected by anxiety by causing headaches, long-term anxiety, which can lead to Alzheimer's or dementia, type 2 diabetes, and hardening of the arteries, and can mess with the psychological functions of the gut. Change the composition of the microbacteria. Reproductive system and immune system. Anxiety, more in women, can cause drop in sex drive as well as can cause infertility. People feel stress. They tend to go to do things that help reduce the feeling of anxiety, such as smoking, drinking. These types of suppressants can actually cause more harm to your body. The cortisol steroid released, and this can put a strain on the power of the immune system. A fact about anxiety. Anxiety disorders are the most common psychiatric illness affecting children and adults. An estimated 40 million American adults suffer from anxiety disorder. Only about 1/3 of those suffering from anxiety disorder actually receive treatment, even though the disorders are highly treatable. Does anxiety have symptoms? Anxiety has both physical and emotional symptoms on our body. Some emotional symptoms are irrational and excessive fear and worry, the feeling of apprehension or dread, trouble concentrating, feeling tense, jumpy, anticipating the worst, irritability, and restlessness. Physical is pounding heart, sweating, your stomach is upset, you feel dizzy, frequent urination or diarrhea, shortness of breath, tremors and twitches, muscle tension, headaches, fatigue, and also it can cause insomnia. How is anxiety treated? There's a couple options that you have when treating anxiety. You have medically or independently. Medically, psychological counseling, which can include cognitive behavioral therapy, psychotherapy, or you can do both. Also psychotherapy counseling. There is also a long list of medications that are given to a patient to help reduce the anxiety. A few of these medications include diazepam, alprazolam, and lorazepam. Independently, someone who chooses to cope this way may talk to a friend or a close friend, family member, someone that is supportive and that they can confide in. Other options are meditate, exercise, which is a really good option when it comes to anxiety, taking a warm bath, practicing deep abdominal breathing. Some people find it helpful to write down a list of negative and positive thoughts to kind of get it all out into view. Short and long-term effects when it comes to anxiety. Some short-term effects are heart beating faster and having a hard time concentrating on things that you're doing, schoolwork, spending time with your family, any activity that you enjoy. Others may experience difficulty swallowing, dizziness, dry mouth, fatigue, headaches, muscle aches, nausea, and sweating. Some long-term effects are risks of stroke, early memory decline, insomnia, detrimental impact to the emotional distraction. Prevention. When it comes to anxiety, early prevention is a huge part of helping prevent the feeling of anxiety and the disorder, such as children with anxiety, stress relieving, finding your own way to relieve some of your stress. Exercise is amazing, possibly enjoying a hobby, scrapbooking, woodwork, painting, refinishing things. Anything that you truly enjoy doing kind of helps take that feeling of anxiety down. Doing things that make you feel better, eating well. When you put good foods into your body, you tend to start to feel better about yourself. The way your body reacts to the healthy nutrients that it needs, that you're giving it, kind of helps counteract the feelings of anxiety, stress, all of that. It makes you start to feel better physically and mentally. And when you start to feel better physically and mentally, you start to feel better about yourself, and it helps reduce all that anxiety and that stress that a person feels when they're not happy with the way that they look physically, the way they feel mentally. Also, avoiding tobacco, drugs, and alcohol. These are all suppressants. These all people do them. They make you feel good at the time. And then once you kind of step back, or you start to feel the effects of the alcohol or the drug, it kind of brings you back into a further depression. Start to feel that anxiety. It gets more intense. That's not something that you want to feel. It's something that you want to avoid when it comes to trying to treat your anxiety.